Hi, I'm Charlie and this beautiful boy is Biffy, and I'm going to show you how to perform a basic clinical exam on your pet at home. This will give you the confidence to know what is normal for your pet and to pick up on subtle changes quicker so you can get them to the vet sooner if they're unwell. So I always start my clinical exams very hands-off. So are they being their normal selves? Are they eating, drinking and toileting normally? Are they making any sort of unusual noises when they're breathing or showing any behaviour they wouldn't ever normally show? The next step, I have a look at their respiratory rate. So this should be between 10 and 30 breaths per minute. So if we have a watch on his, get him lying down again, watch on his flanks here, every time it goes up and down, that's one breath. You want to count that over 60 seconds, or you can count it over 15 seconds and multiply by 4. And it's always a good idea as well to sort of have a look at their respiratory effort. Are they using more effort than they would do normally? Are they breathing more rapidly? And his all look nice and normal. So the next part of the clinical exam, I have a look at their head end. So have a look at their eyes. Is there any redness, any discharge, any swelling? And their nostrils, is there any discharge on those? If they'll let you and it's safe to do so, you can have a look under their lip and have a look at their mucous membrane colour. And this should be a nice salmon pink colour. Good boy. Next, have a look at their ears. Is there any redness, any discharge in either of them? If there is, it could be a sign that they might have an ear infection and it's worth getting them checked by your vet. After then, I try and get a pulse rate or a heart rate. And he's getting into a perfect position for me here. He's just found the stash of treats behind me. So to get a heart rate, if you pop your hand just up behind their left elbow, you should be able to feel the heart going lub-dub, lub-dub. And again, you can count a rate over 15 seconds and multiply that by 4. So for cats, a normal rate is between 110 and 200. For medium to large dogs, 60 to 100. Small dogs up to 140, and then puppies and kittens can be up to double the adult rate. So next, I have a good feel all over their body and have a feel for any lumps, bumps or anything that's painful. So we're having a good feel all the way around. And it's if they'll let you as well, you can have a feel of their tummy and check there's no signs of any sort of bloating, or it doesn't feel sort of bigger than normal or anything that's painful there. And if there is something painful, don't keep prodding it, and don't finish the clinical exam if you think it's unsafe to do so. Finally, you can take a temperature, but we don't recommend you doing that routinely. There are some instructions on the website on how to do this safely with your pet. It's often very useful to have someone help hold while you're doing it. Circumstances where you might want to take the temperature include if you're worried about heat stroke or if they're unwell. If you find anything that you're worried about, it's important that you call your vet straight away. And also, if your pet's getting stressed while you're doing the clinical exam, just stop. It's not worth it. If there's things that you're worried about, just go straight to your vets.